This conference will now be recorded.
Okay, hey guys, this is Matt Dodge with Market Street Wealth Management. I'm joined with Chris Dodge, my younger brother, but also heads up Market Street Insurance Services. And we wanted to put a video together talking about kind of what everybody's talking about, and that is COVID-19, and specifically how it's, impacted with Medicare, what's covered, treatments, all that stuff. So this will be a quick video, but it'll be jam-packed with good information. If you have any questions from this, feel free to reach out either to myself or to Chris. If you have any Medicare specific questions, those will definitely be aimed towards Chris. But for some of you watching, if you don't have his information, you can reach out to either myself, Sharon. We can forward on whatever it is, make that introduction. But anyways, Chris, I appreciate you taking the time to meet with us. It feels like we're right next to each other, but this virtual thing is pretty cool.
Yeah, it's definitely different, but it's a good tool to have, that's for sure.
So but before we get rocking and rolling, what I want to do, I need to share my disclosure really quick, so we can see that, and the overlords will be happy with us. And I think we're good. All right. So we were kind of talking before we were recorded, and actually we got together for the radio show down here this past Saturday, but wanted to send kind of a shorter version of that, the radio show being a half hour. So in the show, and just what we were talking off, before we started recording, a couple questions I wanted to go through. Number one is, does treatment, or I'm sorry, not treatment, testing. So testing for COVID-19, whether or not it's covered by Medicare. Number two, treatment for COVID-19. And number three, vaccines. So we'll unpack each of those individually, but those are kind of what we want to go through for this whole video. So first one, testing. We've heard all in the media, we need to have widespread testing. If someone feels like they, I don't know, having symptoms or whatever and want to go get tested, and they are Medicare age, receiving Medicare, is that covered?
Yeah, and kind of what you're saying about Medicare is, let's just assume that for all these questions, it's going to be Medicare only. So it has nothing to do with group health plans or kind of Obamacare in that sense.
So testing for 65 and over.
Yeah, 65 and over, anyone who's on Medicare for testing, that is completely covered. The thing with that is, it's not all testing in the sense that if you just order something online that says it tests for COVID-19, that's not something that you're going to get reimbursed for with Medicare. Specifically, it's if you go to a doctor, or let's say you're really sick and you end up in the ER and they end up having to test you, maybe they need to hold you for further evaluation. All of those things are covered at no cost. And that's the key, is with testing, any testing related item is covered at no cost.
Okay, because so it's not like a pregnancy test where you take it and almost instantly. I know it's getting, and I say that I have a young child, so I got sent a picture of a pregnancy test. So the COVID-19 is not like that. I know I've seen somewhere where it's a week or 2 weeks till they get the results back. Now, whether what you're saying, if they hold you either for quarantine or whatever during that time period waiting to get that test back, all those, so even more than just the test, the cost associated with having to stay at the hospital.
Yeah. That is true.
So it's covered. What can someone on Medicare expect to pay for that? Is there a cost to them?
Yeah, for the testing, it's free.
Okay.
It's covered. Well, I say it's free. It's stuff that's already been paid for.
Right.
So it's just diagnostic testing, which is covered under original Medicare.
Got it.
So it's covered, like I said, no cost.
Got it. Okay. No out of pocket cost. Obviously,
right.
People
Yeah,
say, "Oh, Medicare Part A is free," and they're like, "No, that's not free. Paid taxes
tax.
for a million
Yeah,
years." So, but you're not going to have to write a check for a Medicare
yeah,
test or for a
yeah.
COVID-19 test. Okay.
Mhm.
So, what about treatment?
Right. Yeah, and that's the big thing is the second it goes from testing to treatment, and with treatment there is no like cure for it yet. So it's not like, okay, the COVID-19 cure. It's more like how can they help with the symptoms that come along with it? So for some people, that you hear the stories that people who are infected and have nothing, to people who are in the hospital for a week, right? Anywhere between that, Medicare does cover that under their Part A, which is hospital as far as those visits go. Part B, whether you need to go to your primary doctor or specialist or whoever you need to go see, right? Now, the difference with the treatment and the testing aspect is treatment, there are out-of-pocket costs with that. And that's where, a lot of people have their Medicare supplement plans and their Medicare Advantage plans. That's where I don't know the exact answer of what the amount will be. That's
Hmm.
something that you kind of have to look into your policy, or if you want to talk to me after the video and we can kind of go over it from there.
In terms of out-of-pocket cost.
Yeah, yeah.
So
So it's covered, but you still have your 20% or your co-pays whether you go to the doctor or not. So
it's like auto policies cover if you get into a wreck. Now, depending on your specific policy, it's going to depend how much you're going to have to pay out
exactly.
of pocket, how much got
Mhm.
it. And that's a big thing you do is helping people get set up. Number one, here's what Medicare covers, here's what it doesn't, and that gap. I think a lot of people are familiar with the 80-20 rule. Medicare, just a rule of
Yeah,
thumb, picks up 80% of the cost. That other 20% is where you kind of step in and help people
yeah.
either get set up with supplement policies, things like that.
Mhm.
Okay. And the last question. So hypothetically, if you're working in your garage tonight and you come up with a vaccine that's approved, you're going to be a very wealthy man if you can do that. But if
Yeah.
a vaccine is approved tomorrow, how does that work? Is that something Medicare covers? And if so, how much can someone expect to pay for that?
Yeah, and so this is an interesting point. This, if a vaccine comes out, um, it'll be covered 100%, which is different than, like you said, most other treatments that are with Medicare, where you were mentioning the 80-20 rule, right?
Mm-hmm.
This one it has a special designation to where if something does is produced, whether it's a vaccine or let's say it's just a prescription like an antiviral or something like that, it is going to be covered by Medicare, for no cost. So it's that is very good news. However, that's like, they're saying they're paying for something that doesn't exist. So it's
Right. Yeah, we're
yeah,
talking
hopefully it
hypothetically.
comes out, but yeah,
And I
if
don't
it
I
does,
don't think Chris actually has a garage where he can work on this. So
I
maybe
was
on your
just about to
back
say
deck.
I'd be in someone else's garage, so we'd have to
Yeah.
split that. Hmm.
And you know, obviously we're not doctors, but a vaccine isn't a cure. And it's no guarantee that,
Hmm.
but if one does come out, which I know there's a couple companies that are just feverishly working towards it. Um, and that kind of brings me to a question. Now, typically for a vaccine, it's got to be a certain time period for to pass, just like really with any drug, before the FDA will approve it. There's really stringent regulations generally. Now, I know COVID-19, we're in kind of uncharted waters. So, has there been any loosening of the bureaucratic reins, I guess you could say, with this specific, COVID-19, a novel virus? What have you seen with that?
Yeah, I mean, really, what I've seen is just kind of, I'm sure if you've listened to the different press releases and things that have been said, is it's kind of the same with every organization that's out there now, is that things are getting kind of peeled back to where we can move faster. So it's as far as like we've gone over testing, treatments, and everything, and how everyone's stepping up to get stuff done faster.
Right.
Same with the vaccine. It's just the testing aspect of it, and I'm sure there's trials, and we won't go too deep into that. It is a little looser, I'll say that.
Yeah.
Mhm.
Yeah. Well, they say necessity is the mother of invention. So it seems like on a Monday you'll hear, oh, this drug or whatever seems to be working, and then it's
Mhm.
chastised, no proof, and then by Friday it's like everyone's on board, so it's amazing how quickly things are moving.
Right.
So three biggies. Does Medicare cover getting tested, treatment, and vaccines? And the answer is yes. Vaccine is unique because it's 100% covered, or the cost is 100% covered. There's
Mhm.
no out-of-pocket cost for that. Lastly, I wanted to ask, this is something that's kind of going over every industry, and that's what we're doing right now, virtual
Right.
meetings. And I know in the healthcare industry, it's called telehealth. So what is that specific to Medicare? Because probably a lot of people listening now, tele what? It's
Tell who.
yeah.
So it's really all like, if you're watching this video, we're doing it right now. So
Hmm.
just imagine this where, let's just say I'm the doctor, and the patient, just, purely hypothetical. Yeah, I mean, it's really just, interacting with your doctor in a way that, those meetings that you go in, and, it's not like you can take your blood pressure or really anything over a virtual check-in.
Right.
But if you need to check up and you just have a question with your doctor, instead of setting that appointment, you just for your follow-up, and maybe you have to get medications and someone to sign off on. You can do it virtually now. And that's not just through video, so you don't need to like have a web cam and just as far as anything production value wise, you can just make a phone call. And as far as the cost goes, it's really just an extension of if you were in the office itself. So if you would have a copay when you go, you're going to have a copay for the virtual check-in,
Yeah.
So it's
Which I did that. I reached out. I had to have a doctor's appointment, and I called in. I said, "Are you guys open?" And they're like, "Well, we're not meeting face to face, but there's this time is available, and we'll send you a link. Click on it, and you can meet with the doctor." Everything else
mhm.
was the same though. So getting it scheduled, paying for it, all that stuff was the same. The difference was I didn't have to drive to Beaufort, where my Beaufort, North Carolina, where my doctor happens to be, wait in the lobby, wait in the waiting room, or whatever. So it was
Mhm.
very convenient. But yeah, I know there's been big pushes. Now, have they loosened anything? I know you talked about before there were requirements for 3 years and
Yeah, the old, and I don't know if it's going to go back to that, but what it used to be was, in order for these kind of visits to be covered, these virtual check-ins or telehealth, right? You would have had to see your primary for whatever you were talking about within a 3-year period.
right.
Meaning, let's say you've been healthy, you haven't really needed to see someone, but then all of a sudden during this time where you're not supposed to leave and go out, you need to go to your doctor. Well, now it is covered. So they've waived that. They've waived other geographical restrictions as far as what you're allowed to use for the check-in, you know. So it's really just kind of the same theme across the whole system, meaning a lot of restrictions are getting waived, just to make it easier for everybody during this time.
Yep. And companies are innovating, guys. So if you're sitting at home, now I know one thing that I wish we could do virtually is get my hair cut. And they still haven't figured out a way to do that. But other than that, I know with our business, you're working from home. I'm happen to be from the office, but I'm not seeing people face to face right now. But as far as we know, COVID-19 hasn't knocked out Wi-Fi signal or phone
Hmm.
calls. So I think we're going to see a lot of things shifting that way. I think this will be kind of the new normal, in a sense. Okay, cool. Well, Chris, I appreciate it. I know we could talk
Yeah.
endlessly on Medicare and Medicare changes, and just as soon as we get done with this video, I guarantee something new will change. So that's the benefit, guys, of having someone like Chris, who this is what they do, what he does day in and day out, not only just helping people get set up, but he's also tasked with keeping up with all the legislative changes. And now he doesn't work for Medicare, just like if I'm helping somebody with their Social Security, I don't work for the Social Security Administration, but you need to you need to be an
Yeah.
expert in all of that stuff so you can show supplements versus advantage plans versus prescription drug plans. Here's what changes, all that good stuff. So guys, if you have any questions with that, if we addressed something that maybe sparked a new question in your head, feel free to give us a buzz. The number locally 252-240-2400. You can check us out online, www.marketstreetwealth.net. And if you think this video would be helpful for somebody else, feel free to pass along this link, and we'll send this out to whoever you think would benefit from this. But we'll still be here. Chris, I appreciate you taking the time.
Yeah, thank you.
This conference will now be